Minister of Health, Dr. Frank Anthony, says the supplementary fund debated in Parliament is necessary and very important for the health sector, specifically for the continued fight against COVID-19 and other medical needs of citizens. Minister Anthony made the statement during an interview on the sidelines of Thursday's meeting of the National Assembly.
Why this is also very important. We know that with the threat of Omicron, the new variant that is circulating in the world, which is right now in about 70 countries. One way to know whether or not we're seeing a surge in cases is to do the PCR or antigen tests. And in many countries where they have seen Omicron circulating, we have seen a steep increase in cases. And the only way you will know that is you will have to make the diagnosis using these tests that we're talking about, PCR and antigen and so forth. So it's absolutely necessary that we procure enough test kits so that we can, if it's necessary, we'll have enough to be able to do these tests.
Minister Anthony added that very critical also is the purchasing of oxygen for hospitalized COVID-19 patients.
So part of the supplementary deals with purchasing the extra oxygen that was needed for the COVID-19 hospital and for other regional hospitals as well.
The health minister said with COVID-19 plaguing the country and the world, determining exact additional expenses would be difficult.
Things that were not considered, that you will need to get these resources to provide for them. We're in the midst of a pandemic. We didn't know how many cases we were going to get for this year. So it's very hard to predict how much money you would need.
Minister Anthony said that with the level of vaccine hesitancy in some regions, funds were also used to send mobile teams into those communities on a regular basis to try and improve the uptake of vaccines.
Because every time we send teams in there, it's not only transportation, you have to give people subsidies, you have to give them a meal. They'll be away for some time. So all of these things add up, and these are all unforeseen things.
The Ministry of Health has requested a supplementary fund of $3.3 billion for COVID-19 medical supplies, medical gas for the COVID-19 hospital, COVID-19 consumables, and reagents. $1.3 billion was also sought for the procurement of ophthalmology supplies and accessories for the expansion of the neonatal intensive care units in 8 health facilities across the country.